fight this deadly disease now from Asia to Europe. Corona. Europe to America. Corona. America to Africa. Corona. Take precaution. Corona. It could be a mama, brother, sister, a father. Corona. Let's stand together. Corona. Mama Liberia. Corona. God bless Mama Liberia.
Good morning. Good morning to Radio Land. Good morning to our viewers. It is a great honor for us to be here this morning on the Mama Lumen Health Talk platform. This platform is a 1-hour program that discusses a wide range of health-related issues. It brings you face-to-face with health professionals and provide you with causes, signs and symptoms, complications of diseases and illnesses affecting us in our respective communities. On today's edition of Mama Lumen Health Talk platform, we will be discussing malaria. Malaria is endemic in Liberia and transmissions occur year-round with all geographic areas. With the entire populations of approximately 4.6 million at risk, malaria is a major health problem in Liberia. Children under the age of 5 and pregnant women are the most affected groups. All the cases are caused by Plasmodium falciparum, and over 90% of suspected malaria cases are tested confirmed. So today, we'll be talking about malaria. We'll discuss what causes malaria, signs and symptoms, complications, preventions of malaria. We have with us in studio Mr. James F. Foma, a graduate of the TNIMA. That is the Tubman National Institute of Medical Arts, and currently doing his post-basic health sciences at the Malaria College of Health Sciences. He has 8 years of clinical working experience in rural community in Liberia. He is also a member and representative of a campaign against racist organization. And we also have with us Ms. Patient Tom. Ms. Tom is an RN with a lot of clinical experience. She currently works at the Exeter and Jolly Medical Center in Ganta City. Ms. Tom is the founding member of the Girls SLs Liberia in the Mama Lumen Health Talk platform. To be part of the discussions, the numbers to call is 0770 107 107, 0886 107 107. You can call us and share all of your experience on malaria or ask our guest panelists any questions you want to know about malaria. So sit back, relax, and please do not touch that dial. We will be back and continue this all-important, educative health talk coming to you just after a short break. I am Mama Lumen, and this is Health Talk.
Begin at tunesliberia.com. We are Project Liberia. Mama Liberia. Must all rise. Let's stand together. Fight corona.
Welcome back. If you are just joining us today, we are discussing malaria, and I have with me in studio Mr. Fomba, who is currently doing his post-basic health sciences at the Malaria College of Health Sciences. Mr. Fomba, welcome to Health Talk.
Thank you, Mama, and I'm happy to be here.
Thank you so much. And next with us is Miss Patient Dump. Miss Tom is a registered nurse currently working in Ganta City. She just arrived last night just to be part of this all important Health Talk show. Miss Dom, welcome to Health Talk.
Thank you.
So let's start with you first. Let me start with the lady first. Even though they say ladies and gentlemen, right? So let me start with the lady first. Miss Dom, today we are discussing malaria. And you heard in my introduction, I talk about malaria being endemic in Liberia. But first of all, before going that far, we're talking about malaria. What is malaria?
So malaria is a mosquito-borne infection that can affect human and both animals. And also, it's a sickness or disease that in our layman term we can say our own sickness, because in our sector it's something that if you go to the hospital, you go to the clinic, most of the cases or diagnosis, it can be malaria, especially for children and pregnant women.
Children under 5 and pregnant women. Okay, thank you so much. So let us move to Mr. Foma. Mr. Foma, can you please tell some of the causes of malaria and how can it be spread? How can we get this malaria?
Malaria has just a very one way cause that we all know is it's a transmission that occurs from an infected mosquito that bit somebody who has malaria and also came overnight or any time of the night and sat on your skin and then bit you, and in return suck your blood and at the same time transmit the infected parasite into your body. We call that plasmodium, as the moderator was just saying. So basically the transmission of malaria is just between that line. There are other sources where mosquitoes can breed and things, probably we'll talk about later. But the first thing I want to know here is how malaria is transmitted. It is transmitted through mosquito bite. And another slight medium that malaria is transmitted, it is also transmitted from mother to an unborn child. There are chances during pregnancy. Okay. So you will notice that malaria has the power of crossing the placenta to go all the way to the unborn child. And then sometime during delivery also, malaria can be transmitted to the child. So these are the ways that I know that malaria can be transmitted.
So you were talking about it can be transmitted from mosquitoes to human. So which one of the mosquito malaria can really be transmitted?
This is a laughable stuff. Sometimes when we say, female Anopheles mosquito, so people would like to also ask to know, how does this female Anopheles mosquito look like? But all mosquitoes should be avoidable. In general, let's just tell the public today that all mosquitoes, we have to avoid all mosquitoes because we will not have the scientific knowledge to distinguish between female Anopheles mosquitoes, a mosquito, and that of the other ordinary mosquitoes that we see that right here.
So why it is called female Anopheles mosquito? It is because female to reproduction or what?
That is a scientific name that is really given to it. But inside the mosquito itself, there are a lot of changes that occur before the transmission take place. So basically the scientists look at the replication that occur in them and then try to name it as female Anopheles mosquito.
Okay, he was talking about it can be transmitted from mother to child, it can also be transmitted from female mosquito. I don't know anyhow, because when you say female, then that's a personal attack. But anyway, I myself learned in school that the female Anopheles mosquito always carry that the signs of malaria, right? And then when it bites you, it's going to leave that malaria in you and go to another person. So you know that female are people that those who reproduce, we do a lot of stuff. So anyway, for the benefit of the audience and that of the lady process, female Anopheles mosquito is the mosquito that can give malaria.
Yes.
So Dom, can you please give us some signs and symptoms?
Well, first of all, if you come in contact with a mosquito bite, it will take 10 to 15 days before you start to show signs.
That's the incubation period.
Yes, that's the incubation period. So if the mosquito bites you during that time period and you are infected by the malaria, you start to show signs or symptoms like fever, chill, headache. Some people can sweat a lot, like that you just see yourself sweating. Some people lose appetite because most of the time the signs and symptoms varies. What can happen to another person will not be in the case of another person.
Okay.
But generally, most of the time, the few common signs and symptoms for malaria in our setting, you will have fever. Fever is one of the most common signs. Fever, chill, loss of appetite, sweating. These are the few signs and symptoms that you already experience.
Okay, thank you so much. We were talking about the female and non-female mosquito. Let me just come back to you, Brother Former. Brother Former, there are how many types or kinds of malaria?
Malaria, the one that are very prominent in our setting, and they are named in the book, are 5, but basically we have to talk about 4. The 4 types are, we have Plasmodium falciparum, Plasmodium malariae, Plasmodium vivax, and Plasmodium ovale. These are the ones that really are required to be in our setting. But the basic one that is really seen in our setting and is read under the microscope and using the rapid diagnostic test is the Plasmodium falciparum, followed by Plasmodium malariae, which is very seldom. So these 2 are the basic one in our setting. That's why we, in our various hospitals around here, we have medication that can really take care of them. The only thing I want to tell the public is that all of these different type of parasite that we just named, or malaria that we just named, we should not just sit, as my sister said, just give you the signs and symptoms. We should not just sit home and medicate ourselves. The only people that have to confirm that you have malaria, they are the health practitioners, because the signs and symptoms that were named, they are constitutional signs. Like people who have typhoid fever come down with fever, headache, and like you said, and people with sepsis also come down with that condition. People with pneumonia come down with that condition.
Well, you go right too far. Even people with coronavirus,
sure.
With the same signs and symptoms.
Sure. So we have to not medicate ourselves home, but let's try as much as possible to go to the hospital and be diagnosed, which we term as confirmatory diagnosis.
Okay, thank you so much. But you know why? Most of the time, people feel that the way they got the 5 type of malaria, like you listed, the P, Plasmodium fava, the ova, the Plasmodium malaria. But some people feel that because it's called malaria, so the Plasmodium malaria is always the cause of malaria, which of course in Africa, absolutely no. The P. falciparum, Plasmodium falciparum is always the agent. The naughty area is rare for you to be found in Liberia. It's not in Liberia. But that P. falciparum is always our major problem in Liberia. And we were talking about the various type of Dom, let us look at this. What is the differences between complicated, you being in a hospital setting, you being taking care of patients, especially these cases come a lot. So how can you differentiate complicated malaria and that of uncomplicated malaria?
Well, you can give the difference based on the complication of the malaria. Most of the time, you can diagnose a person of complicated malaria if the malaria is associated with a lot of things. For example, anemia and the high parasitemia. Like for example, if the parasite is higher, so if you do a diagnostic test and the person comes down with like 3+ malaria, 3 above, 3, 4+. So like that you will say complicated malaria. So that malaria will be complicated by high parasitemia. And another example is if the person comes, because you know that another complication for malaria is anemia, the blood low. Most of the time, because I work on peace war, most of the treatment is someone that blood can drop to 6 grams, 3 grams, 4, 5. So like that malaria is complicated by anemia, because that's what the malaria can do. If the parasite enter your blood, it start to drain down. And most of the time children, you know, they don't have to do. So most of the time, they can have complicated malaria. Only few children when they come be one blood.
So what's about it? What make them different to be uncomplicated malaria?
Because they are risks.
Okay.
Children are risks mostly.
Okay, to add to what Dom said, I think she's really right when it comes to how can symptoms for us that we should set at the back of our minds as listeners. There are signs and symptoms that malaria show that can really help us as clinicians to know that yes, this is complicated malaria and this is uncomplicated. When they say complicated, malaria is very serious. When they say complicated, malaria is serious. When they say uncomplicated, malaria is there, but it has not reached the stage of seriousness where life is about to go, right? In uncomplicated malaria, which is life is not threatening, it's not life threatening, we will say patient will come down with fever, they will have headache, like she said, sometimes vomiting, and sometimes they will have the urge to vomit, which we call nausea. They will be nauseated, and their skin will be hot on the surface. Even when you touch their skin is hot. That is how uncomplicated malaria show. But any of those signs, either with convulsion, and sometimes like lethargic, that is extreme weakness, and if it is a child, the child is not able to suck, then the malaria is becoming uncomplicated. So these are signs. It's all depend on the signs and symptoms that can make you to differentiate between complicated and uncomplicated malaria.
Okay, because we have a case in Cat the hospital. I think that was 2016. A wearable dieta. This patient came with complicated malaria, where you can hear like brain posted the malaria claim in his brain, right? He was really acting confused, like he even went into the chair and then knocking some of the nurses' head, like the hospital also then we have to call security to really restrain him in a way that so he can stop disturbing the hospital, right? So when cases like that, malaria is really dangerous, right?
Yeah.
Like when you're talking about complicated malaria, that's the time the malaria can go into the brain, because the whole body function uniquely, right? When you see change in behavior, confusion or drowsiness, right? Hypoglycemia, like what Dom was saying, most of the time you see the blood will be very low. Most of the malaria cases, especially children, sometimes pregnant women, but mostly children and pregnant women can always come down, because when you have malaria, you always experience that type of low blood, right? Difficulty in breathing. Sometimes they will not even breathe, and this is one of the signs and symptoms of COVID-19, right? So like, you having difficulty in breathing doesn't mean you got malaria. You have to go to the hospital. And then let the doctor differentiate, do the test and everything, so your result can come out and your diagnosis is malaria. It could be difficulty in breathing. But if malaria is absent, maybe COVID is positive, it could also be difficulty in breathing. So thank you so much. Let us look at, let me come to you, Brother Fuma. Now we are in a crisis called the COVID-19. How will the focus on coronavirus advise the impact the management of malaria?
Firstly, malaria become virulent in people whose immune system is compromised. Maybe we have to say another way around for our audience to understand. We got special things play inside us in our body that is responsible to fight sicknesses. And in the presence of COVID entering into your system, remember COVID is a viral condition, that will lead to some extent your immune system being compromised. When I say being compromised, will not be too strong to fight other conditions. So in that light, the malaria, will become very much opportunistic, in the sense, even if mosquito bit you and your immune system could like overcome the power of the parasite in your system, but because your immune system is compromised at that point, malaria parasite begin to grow and then will manifest and change the whole situation around. Because if you have COVID-19, like what the moderator is saying, and then at the same time having malaria, you will find out that you will have a lot of deterioration into your body. unless you have to be managed intensively, that is, you have to be taken to the hospital and the doctor and nurses look after you all the time. So I think that is the only way. But if you sit home, it becomes something deplorable for you and may eventually take off your life.
Okay. Thank you so much for that wonderful explanation, Tom. You work at the hospital setting, right? In your viewpoint, which is more reason for malaria treatment failure? Healthcare professional or patients' poor medications practice?
Well, first of all, I would say the patients.
Why?
Because most of the time, when the patients start to have the signs and symptoms of malaria, the first thing they do is home treatment. They don't even come to the hospital. And one of the things, just as my colleague was saying, we should encourage people to come to the hospital. Home treatment is not good. Because the first thing, you don't even know what you have. But because in our setting, we already used to the few signs and symptoms, so your head start hurting, you start getting fever, you say maybe like malaria. Because some people can even say that how my own malaria can come. So my skin start getting hard, and I start having diarrhea, and no straight at malaria. Why is that time for? Even if you have the malaria and you assume that you have the malaria, you don't know how many plus malaria you have. You don't know the degree of the parasite in your body. It will lead to complicated malaria.
So is that the cause of treatment being failed?
Yes, because most of the time the patient do their own treatment home. And some of the time, even if they come to the hospital, we do the treatment, the home treatment we give them. As soon as they start to feel better, they start to develop the medication or in the community. I went to the hospital, I having malaria, they gave me the home. Most of the time, they don't even end the malaria treatment. Like for example, when you go to the hospital and you come down with the malaria, most of the time it's the complicated malaria. For the children, we give them the IV doses. Either we give them the quinine protocol or we give them the artesunate, and as soon as they start to feel better, when they are going home, we are accompanying that going home with the PO. And most of the time, the parents don't even give the children the medicine. They give it 1 or 2 times because most of them they base it. Most parents don't even sit home to take care of the children. They go there and you see that you have break in the medication. The medication is done straightforward. And most of the time, sometimes they even forget. So in that way, you will see that you will have a lot of failure. And after a few times, it will reoccur again. You come down with the same malaria and you see the same people coming back again.
Okay, thank you so much. I think that is our issue in this country. Number one, we do abuse drugs, right? We, like she was saying, when someone have the signs and symptoms, they just go to the over-the-counter drugs, go to the pharmacy, tell the person that they, oh, I want a medication because I'm feeling this. And one good thing I like about Liberia, their main objective is to make the money, to sell their drugs. So once you go and want paracetamol, most of them, they don't ask you what you're going to do with the paracetamol, right? So most of them, they don't really want to know. And I think that is one of our main problems, why the treatment of malaria always fail. Because like she was saying, patients don't complete their treatment. Most cases, malaria treatment have to be completed. Because if you're on a treatment for malaria for taking to the hospital, but they forget it to know that they have to cure that particular disease or virus within the body. So thank you so much. Now we are going to open the phone line to be part of the discussion. The numbers to call are 0770 107 107 0886 107 107. So you can call and share your idea. Call and tell us what you know about malaria. Anything you want to know about malaria, call and ask our studio guests some questions. So the numbers to call are 0770 107 107 0886 107. On our short commercial break. On our short commercial break.
Begin at tunesliberia.com. Hey, project.